Hello, hello. Thank you all for joining us tonight. We're coming to you live from the Ann B. Reichsman Community Health Center, where we're all in separate rooms so that we can be unmasked for this great celebration of the legacy of Ann Reichsman. We certainly are glad that you can be here today. We all very, very much wish that we could be celebrating Ann's retirement in person, but circumstances, as we all know, have not permitted that to happen. So you're going to hear from me a little bit later, but right now I'm going to start the program by turning this program over to our Chief Medical Officer, Dr. Eric Kaufman. So Eric, can we hear a few words from you about our beloved Ann Reichsman?
Well, good evening, everybody. I do have some words to share with you all about Ann, kind of a tribute to Ann. And when tasked with how to tell the story of Dr. Ann B. Reichsman, it became clear that this is a story of legacy building. What is legacy? It's like planting a seed for a redwood tree, which you know has the capacity to grow hundreds of feet tall, but may never see its full growth. You hold on to the hope and vision of what that tree will provide to future generations. The tiny seed was planted in 1980. There were two brand new doctors from Metro Hospital who decided they wanted to try their hand at providing truly patient-centered care in a medically underserved neighborhood, the Stockyard districts on the west side of Cleveland. They found some grant money and a biker bar that had recently closed on Storer and West 65th Avenue. They hung out a shingle, removed the bar stools, and opened the doors to the community. They had planted the seed. Ann was there early on, a trailblazer on a mission to care for this fragile idea that had been planted. The care of this sapling, once sprouted, required watering in the form of hiring and in training an entire staff in ironing out the many kinks that come with starting a medical office. True to their philosophy, they cared for the entire family of those who came to the clinic, the whole family tree, if you will, treating great-grandmothers and delivering great-grandbabies, or catching them, as our midwives say. Some don't know, but Ann delivered babies for years, many of whom were still her patients until she retired just last month. The NFP model required this all-around care, and Ann exemplified it. But it wasn't easy. Early on, she rounded at 3 different hospitals at the time, beyond her regular clinic duties. The tree grew mostly straight and tall over the last 4 decades. Times of financial stress didn't bring it down, but there were some pretty scary times. Hard work, faith, and authentically caring people at NFP always helped it through. And as the trunk strengthened, so did its branches. Ann led the growth of more services and more offices, always guided with the idea of helping families achieve healthier and happier lives. The tree's roots grew to become part of the very soil of Cleveland, the fabric of the city, along with Dr. Reichsman, a household name to many West Side families. A key feature of this now towering hardwood, one that Ann might say she is most proud of helping to foster, is the integration of behavioral health into primary care. Ann would encourage providers to concern themselves with another tree, the graphic family tree that were in our old paper charts. And Ann drew incredible graphic representations of the families that she cared for. She knew, having trained in family therapy as well, that the behavioral health blended closely with the physical health of people and stemmed from their family in one way or another. Perhaps more important than how diseases travel in families is the relationships among family members, both immediate and extended, that help to map the functional dynamics amongst each other. Ann used this knowledge of family structure to slowly and steadily coach and motivate individuals and families as social collectives to function better and meet their fuller potential, to be greater parents, to be better partners, to be better workers, and to be better citizens. Some might say it was a way to build stronger roots. Ann understood long before youngsters like most of us the vital connection of the mind and the body. I am thankful that she has taught me and many others at NFP to understand this integration. A key person by her side in this pursuit was NFP's first social worker and therapist, her husband, Bruce Catalano. And I think some of you have had the opportunity to know him and work with him. I could talk for a long time about the things that I have learned from Anne. Many of us can. But one of the most important things is that healing takes many forms. There's a cure of an infection with an antibiotic or the prescription of a drug for disease. It gets a lot of attention in medicine, but that's often the easiest part of medicine. Usually it's one problem, one treatment, and a cure, and it's done, it's over. What's really challenging and takes great patience and empathy, commitment, and time is healing the whole complex individual, their family, and even one step further, the community. Anne accomplished this healing and therapy over years, even decades, visit by visit, during receptive moments during those interactions in the spaces between acute care, chronic disease management, and preventive care. Anne and her 40 years commitment to NFP has actually helped to heal and advance the health of the entire NFP community. This is the life work of Anne B. Reichsman. This is her legacy. Before Anne retired last month, I was chatting with her and some other folks in the hallway at Ridge. One of the other people there asked her, said, Anne, how do you feel about your retirement after so many years at NFP? And Anne sort of cocked her head to the side a little bit. She paused and she answered quietly, I've accomplished what I came to do. I just want to say that again. She said, I've accomplished what I came to do. And, I thought that is so powerful. That is so simple. And it's really so Anne Reichsman. If Anne doesn't say this at the end of our career, that we've accomplished what we've came to do, we will have truly had a blessed life and a life of impact. One piece of advice that Anne gives to young providers, and I was once one of those young providers, is don't work harder than your patients. This was good advice. It combats providers' frustration with patients who are not following through on the plans that we as a provider have made for them. Perhaps the patient has made some bad decisions. Perhaps they slipped back into something. And it can be frustrating for providers. It was really good advice. But there was another moral to this story, which I'm not sure I have ever heard her say, which I saw her live during my 21 years working here at NFP. And the unsaid moral is this: work every bit as hard as your patients on their issue or their problem for as long as they want to or as long as they need you to. And for Anne, this has been a 40-year journey. Anne, thank you. Thank you for planting the seed and nurturing and growing the beautiful forest that NFP has become. We are grateful for the legacy that you have created, and we will carry on the work that you came to do. So now I would like to pass on the program to Dr. Kurt Stenge. He is a long-time NFP provider. He is a noted health services researcher and a fierce advocate for primary care. Thank you.
Thank you, Eric. Dr. Anne Reichsman is a community leader. She leads by example, working on the ground with individuals and families, and then taking that grounding to the level of the collective to show what can happen if we listen and work together. For Anne, there are many communities. There's the community of people working together to improve the quality and equity of care. Anne's been a leader in the local Better Health Partnership, serving on the steering and clinical leadership committees. And at a time when many healthcare organizations are using data to compete with each other, Anne was really an exemplar at helping us to bring together data to learn who's doing well. And if she looked at it and said, okay, if someone else is doing better than us, we want to know about that so we can learn from them. And if we're leading the way, we want to show that and show other people how to do that. That's unusual, and it's had a big effect on our community. At the national level, Anne serves on the OCHIN Clinical Group. OCHIN's a national resource that provides information technology support for community health centers. And she's widely seen as wise and contributing a lot to that group and having a national impact. So that what we learn here in Cleveland can have a national impact, and what's being learned around the country can come back and inform our work. There was another national initiative called Prescription for Health that was really about integrating behavioral health into primary care, which, as Eric mentioned, is something that Anne's been a national as well as a local leader on. And I remember that Anne was invited to go to a meeting with Phyllis Marzan, who is the Hispanic outreach worker, the forerunner of the current patient advocate position. And this was an unusual meeting. They had two of the big names in the field, Ed Wagner and Sue Curry. But rather than have them speak and have everybody else listen, this meeting was organized so that people like Anne and Phyllis shared their wisdom, and then the outside muckety mucks listened and shared things what they'd learned at the end. And this really formed this large national initiative, had a formative effect. And at the end of this meeting, I remember Sue Flocky and I were waiting for a taxi to take us to the airport to fly home. And Anne and Phyllis were going to their car to drive home, and they said, "Why don't you come with us?" And so we bagged our flight and went with them. And I think kind of a miracle happened because Anne and Phyllis had paella for dinner the night before, and they kept it in their room overnight, except they didn't have a refrigerator. And so we drove to Cleveland, shared a lot of good formative ideas from what we learned at the conference, and none of us got sick. There's also a community of people working to amplify the voices of people suffering from an unfair system. Anne is widely known as an advocate for social justice, and particularly for access to care. And I think We Are the Uninsured initiative that sprung out of Neighborhood Family Practice that had some effect on framing the Affordable Care Act was something that Anne was passionate about and worked a lot with. I probably know Anne best from the community of people conducting relevant research. Anne helped to launch 2 local practice-based research networks, groups of clinicians and practitioners, administrators at practices whose primary focus is taking care of the folks, but who say we need to generate knowledge that's relevant. And so she launched the Safety Net Providers Strategic Alliance, SNAPSA, that brought together administrators of the community health centers and the clinicians, and conducted some very interesting and relevant research. One study that she led was about people living with diabetes. And very interestingly, this study from the clinician's point of view, we discovered that people out of control from the diabetes, we clinicians all thought it was because of the larger system, all the things that were stacked against people and getting in their way. And then when we asked the patients in this study, the patients actually were blaming themselves. They said, "Oh, we're not doing well enough." And so I think that really informed our practice in the network, and it informed our advocacy efforts to lead to a system that actually supports people rather than making them feel guilty about what they're unable to do with the cards stacked against them. Anne participated in the groundbreaking direct observation of primary care study that looked at how do you integrate care for whole people in a fragmented system. She was involved in multiple clinical improvement trials. She's actually involved in helping to set up a new trial now with OCHIN that we're doing locally and nationally, trying to take what's being learned from the pandemic. What are the good things from this? What are the good things about telehealth that we can take forward? What are some of the problems that we're having that we want to make sure we leave behind when the pandemic's over? But it hasn't all been fun for Anne. She participated in one study that was about how do we take a strengths-based approach to care rather than just focusing on patients' deficits. And that study was done with colleagues in Norway, and Anne had to go to Norway during 2 July summers and hang out with our colleagues on a fjord in Norway. So it hasn't all been just fun and games. Anne also started the research committee at Neighborhood Family Practice. How many practices, how many community health centers have a research committee? But it's part of the culture that Anne set up here, that we want to be part of generating new knowledge. We want to collaborate with others in the community that are doing that and trying to make a difference. Anne's also been a role model and an exemplar in the community of people training and mentoring the next generation. I think many of us, probably most people at Neighborhood Family Practice, consider Anne a mentor for us. but she also extends to students of all kinds that come through here. We're very grateful for what she's done with the Family and Preventive Medicine residents. Ann was named Ohio Family Physician of the Year a while ago for her clinical work, for her teaching, for this kind of community work that she does. And the last community I'll mention that Ann's a leader in is the community of innovators who are trying to do the right thing, even when the wind is blowing in other ways. Eric mentioned how exemplary she's been in behavioral health integration into primary care and in making family systems theory and the family focus something that's a reality. She got us into the electronic health record earlier than others here and got us to take a population focus as well as a focus on individual people. Ann's created a culture of caring and for people at NFP and for the larger community. And she's done that by just her way of being, by leading by example, by investing in relationships, by sometimes being willing to take the difficult conversations, by sacrificing of herself, and yet also showing us that you can't take care of others if you also don't take care of yourself. So showing us this balance that she's exemplified really through her whole life. Ann was named by Crane's Business Magazine as a local healthcare hero. For many of us, for me, she's a hero in how to live a good and meaningful life. And we're going to hear from her right now, from Dr. Ann B. Reichsman.
Well, thank you, both of you. You're saying lots of wonderful things, and it's a pleasure to hear them. And I want to thank Eric for stepping into the CMO role, Chief Medical Officer role, when I stepped back into the exam room and doing such a wonderful job there. And I'd like to thank Kurt for all the encouragement and education you've given me, mentoring me as I found my way into trying to do some research. And greetings to everyone who's here with us virtually tonight. As you all might imagine, I've been thinking a lot about my 40 years at NFP. Particularly, I started thinking a lot about this when I discovered that 40 plus 70 equals retirement. And I'm going to talk about memories. And while I'm talking about memories, I'm going to do a lot of name dropping. And a lot of these names may be unfamiliar to most people, but they're names that I want to hear and want to think about. And to those of you who know those people, I think it'll be meaningful to hear them. So I'm really going to talk about the roots of the tree that is neighborhood family practice. And I identified 5 essential roots. I know there's a lot of others, but the ones identified were mission, neighborhood, vision, growth, and allies. And the mission was put into place by Barbara Teppen, who later became Barbara Teppen Sprague, who during her residency decided that she wanted to stay in Cleveland and that she wanted to continue to work in the same neighborhood that we had served at Metro. And she thought, the majority of the people in the near west side of Cleveland don't have access to holistic family, high quality care, despite the fact that there are lots of, healthcare communities around. There's nothing really in the neighborhood. And so she got together a group of activists who had been working on healthcare issues for quite a few years, and also residents who would later become patients. And together they created a group to develop plans for neighborhood family practice, and then they became the first board. So we had mission as our basis, and we have worked, I can't say that we've done it, but what has happened is that the mission has been infectious. And so as people joined the practice, they either came with the mission or they became very interested in the mission. And this has continued, and we know that there's something pretty special about neighborhood family practice in this way, because about halfway through my time here, we had a group of CASE graduate students who worked in the organizational behavior department and who came and did something called an appreciative inquiry. And the appreciative inquiry looks at the strengths of an organization with the idea of building on those strengths. And one of the strengths they found, the one that really resonated with me the most, was that if you asked any group at NFP, whether it was receptionists, whether it was the person who roomed the patient, whether it was the provider, whether it was the administration, whether it was the board, anyone that you spoke to had part of the reason for them being at NFP was our mission. And this is very unusual. So it's something that has made us very strong and continues to make us very strong. Second root I'm going to talk about is neighborhood. So the employees are very often from our neighborhood. I'd say the majority of our employees are from our neighborhood. And our knowledge of our neighborhood is enriched by having employees from the neighborhood. And also, of course, we learn from our patients. And that really keeps us grounded and keeps our roots firmly in the ground. Three of our earliest employees were Lynn Stepke, Barb Starry, and Mary Caldwell. Lynn Stepke was our first medical assistant. And she was very active in her parish and pretty much knew everyone in the neighborhood. And her husband was a union representative at one of the large factories nearby. And so he had extensive networks as well. And we benefited from that. And then Barb Starry was one of our early receptionists. And she really was the mother of the neighborhood. She really tried to make sure that people had what they needed and that she would make sure that if NFP could do it, it would get done. And we saw that continued in our dearly beloved receptionist, Bonnie Jung, who retired recently. And I think that all of our neighborhoods now have people handling phone calls, interacting with our patients who have that same attitude, that same approach. Does the patient need something? Let's figure out how we can help them get it. And Mary Caldwell was our first nurse. She was a community health nurse, and she did home visits and patient education, and we miss her dearly. The next root is vision. And it starts with a sad story. There was one time when we were looking for funds from foundations, and two of the foundations that we asked for help turned us down. And in turning us down, one of the foundations said that our model was outdated. And the other one said, that's a Cadillac model. Well, my response to that was, so what are we? We're a Chevy neighborhood. And Sally Tatnall, who was the executive director at that time, was able to, bring us back from that disappointment. And she kept telling us over and over again that we were a model for how care should be. And I think a lot of us sort of said, well, we're just doing our jobs. We're just doing what we're supposed to do. It's nothing special. And she had that vision that this was a model for healthcare in the future. And as we've seen with the PCMH, the patient-centered medical home, that practices all over the country are trying to do what we do. And then when you talk about vision, you have to start talking about Jean Polster. Jean's joining us as Sally left, really took the vision thing and just quadrupled, quintupled, I mean, just exponentially increased our vision. And it's a vision that has sustained us through all the transitions we've been through. And that brings us to growth, because this root of growth has been not just growth in the different sites and being able to care for many more people than we did at the outset. It was also growth in terms of programs. And we've added all sorts of different things that people need. So it started in the 1990s with the behavioral health program. And behavioral health has always been very important to me. And this program was even nearer and dearer to my heart since it was my husband running it. And then the next program that was added was midwifery, which grew out of our family planning program. Supervised, this growth was supervised by Sally with the help of Susan Green, who became our first midwife. And now the program is huge and stable and just a marvel to behold under the leadership of Katie Maestros. A refugee team was started. And that is such an important way for neighborhood family practice to reach out to some of the most vulnerable people that live in the Cleveland area. And then following that, we had dental. Dental's a difficult program because dentistry is not always valued. People don't realize how important your mouth is in affecting the rest of your body. And one thing that I think is fairly well known now is that certain germs that live in your mouth can trigger your body to create antibodies that can then damage your heart. So by helping to prevent cavities, you actually help to prevent heart disease. So it's an important program. It's a very difficult one for a federally qualified health center because the funding kind of goes up and down. And so you can't really rely on what's going to happen if Medicaid is going to pay for it, if insurance is going to be available for the patients. And Jean was really just so certain that we would be able to do it. And it has, in fact, been very successful, and it has grown. And then the most recent program is pharmacy. So really helping to get affordable medications for our patients. And most recently, under the guidance of Katie Pazendak, we've been able to start a home delivery program for our patients, which makes it much easier for people to actually adhere to their medical regimens. And then finally, allies. We've had tons of allies over the years, and some of them in very unexpected places. We found that there were people in the federal bureaucracy who had gone into that job because they really wanted to help make the world a better place. And there were lots of people who, once they sort of felt how mission-driven we were, really went out of their way to make sure that we were okay, to make sure that we got what we needed. And then there were the foundations. The foundations have been extremely helpful to us. And there's so many of them in the Cleveland area that are doing such good work. I'm not going to try to mention them all because it would take too long and I would forget some of them. And the hospitals. We've had particularly close relationships with Metro and with Lutheran. And Lutheran has really been a partner to us in so many of the things that we've done, and we appreciate that. And then, very importantly, our individual donors. People who have become aware of what we're doing, what we're trying to do, what we want to do more of, and have helped us and joined in the fight to, make sure that people have the kind of health care that we all want to have. And so one of our programs that we have through the pharmacy is funded by individual donors who have given us money so that our patients can afford their medicines. So in addition to a federal program that helps people below 200% of the poverty line, we now also can help some of the people who are above that who still can't afford their medications. So for example, things like insulin and inhalers, which are both life-saving treatments, can sometimes run $300 and more a month. And so, of course, normal people who are working sometimes 2 and 3 jobs to make ends meet are not going to be able to afford those medications without the kind of help that our donors allow us to give to them. And I'd like to specifically call out 2 friends of mine, which have been really steady, loving, and generous people. And that's Claudia Metz and Cynthia Bell, who have helped us for all these 40 years. So these are the roots of neighborhood family practice that are going to keep neighborhood family practice strong as we go into the future. And who knows what kinds of interesting things we'll be doing next week. So I want you to know that I am feeling very loved and appreciated. And I want to thank all of you again for being here tonight. And thank you.
Well, Anne, 19 years we've been together, and it's just been wonderful. I'd like to just take a couple of reflections on your legacy and what you've meant to the organization. As you may recall, a number of years ago, more than 10 years ago, we decided to christen the Warm Heart Award, the Anne B. Reichsman Warm Heart Award. Let me just read what that exemplifies, because it certainly exemplifies all of the great characteristics that you've brought to neighborhood family practice. The Anne B. Reichsman Warm Heart Award recognizes an outstanding staff member who has demonstrated dedication, expertise, and concern for NFP patients in a compassionate and comprehensive manner. Nominees must demonstrate their extraordinary efforts in support of the organization's overall mission, vision, and values. And I think that that certainly expresses how I feel about Anne and the heart that she has shown. And then a few years ago, as you just saw in the pictures, we christened the Anne B. Reichsman Community Health Center, which is the health center where we have the most comprehensive services for women and their children, and of course the whole family, which is something that Anne's believed in so strongly that we wanted to leave a legacy of one of our health center locations to be named after her. But one of the things I want to really stress, and it's been mentioned earlier, is Anne's commitment to social justice. When I joined NFP and began to work with Anne, 25% of our patients lacked health insurance, and thank goodness that's no longer the case. But we worked together to try to advocate for the needs of our patients with anyone who would listen. And that would include, the partners that Anne mentioned, and of course, also legislatures. But, when I think about social justice, and certainly social justice and diversity, equity and inclusion, intersectionality are certainly on our minds, particularly over the past couple of years with some of the tragic events that have really heightened our consciousness. And I've thought a lot about how there are folks that talk about awful situations and the need for social justice, and then there are people that do it and live it, as Eric said, who've done what they came to do. And Anne has a constant spirit of believing in the best in people. And that includes the staff, her family, her patients, everyone. She sees the beauty in everyone. And that spirit of trying to care for everyone in our community, regardless of the circumstances, she has a philosophy that when you cross the threshold of neighborhood family practice, you are ours. And we're going to do everything that we can to take care of you. We had a staff meeting this morning, and we were listening to some stories of staff who've gone that extra mile. And that's really Anne's legacy. And when I was privileged to join the organization, like I said, 19 years ago, I really was bitten by that infectious spirit of there's no constraints to what you can try to do to improve the community and improve the neighborhood and leave a legacy of people who believe that. And I'm just so privileged to have worked with Anne and watched how she's mentored me and others to really believe and walk the social justice walk, to believe that everyone, regardless of their circumstances, their addictions, their issues with themselves, their families, that everybody deserves the highest quality care that we can possibly provide. And that is really her legacy. We faced many tough times together, and there were some tough times before, as Anne alluded to, but the idea of delivering personalized care and the best care that we could give, that never wavered, even during those tough times. Those hardships made Neighborhood Family Practice a stronger organization because we've known what it is to have to really struggle to give care to folks. And now in somewhat better times with better coverage for our patients and more services that we can provide, we are a significantly stronger organization. And I just thank you, Anne, for your legacy and what you've helped us build for this community, now serving 22,000 people. When we started with the first patient at Storer Avenue with you so many years ago. So your legacy will carry on in the smiles and the good work of the staff and the so many clinicians that you've trained. So I'm just going to close with a couple of things. One is I'd like to ask you to help us. We have decided with Anne's retirement to christen the Health Access Fund. As Anne mentioned earlier, although we received some funding as a federally qualified health center for charity care up to 200% of poverty, there are many needs that funding does not cover. There's financial assistance for folks who maybe make a little bit too much for some of those programs, but we're still offering financial assistance to those individuals. There's the interpretation costs for the thousands of resettled refugees that we care for on an annual basis. And then there's, of course, transportation, because you can't get good health care if you can't get to the doctor. And so we're going to ask you, please, to consider helping us as we move forward with our newly christened Health Access Fund as a part of Ann's legacy. I believe there's a QR code on your screen that you'll be able to use, or you can certainly donate directly on our webpage, or click the donate button in the right-hand corner. So I hope whether through your financial donations or for getting more involved in the work that we're doing here at Neighborhood Family Practice, I hope that you will all help us so that the next 40 years can be as strong and successful as the 40 years that Neighborhood Family Practice has shared with Ann. Before I close, I want to acknowledge that Ann has a rich personal life. And many people love her very, very much. And so some of her friends, Sandra and Jane from Portland, and their family have penned a poem, which I will read to close us out this evening. We do have a couple of other little tributes, so hopefully you'll stay on. But here is a poem. Ann is not fickle. She's helped in many a pickle. Her daughters, she still does tickle. She's going to be free. She's going to flee her hard-working MD. But it could follow her around forever like a little puppy. She's earned a celebration with our adulation. We can cry if we want to, but it's her party. Bring out the trays and the chips and the dips, the performance of plays and the circus backflips. Turn on the music. They have quite a stash. She will wear a purple dress and will make it made quite a splash. A sight to behold, her dance moves so bold, so everyone joins, just shaking their loins. When all is quiet down, we hope she'll be found going inward and outward bound. In the mountains, by the oceans, near her friends all around, some rest and relaxation, and lots of rejuvenation. But listen, these little ditties from two old biddies can't compare. We wouldn't even dare. The talent right at hand could start a band, starring the Annie, Brucey, Amelia, Adam, Louisa, and Tomas clan. Here's what we gotta say as we wish you on your way. Ditch the gurney for the journey. Love and hugs go with you always, day by day. May I welcome Ann up here. Ann B. Reichsman. So first of all, stand. We would like to present you with these flowers as a tribute of our thanks. Beautiful. Thank you. And I believe we have one more.
You may be out of hands,
Oh
but we have this plaque, which is made by our favorite upcycle artist, Nicole McGee, and previous employee. I'll hold it up.
Please do.
Yeah.
It's just beautiful. Wow. You can push it up to the screen a little.
Oh, thank you. Thank you. Thank you. In purple, of course. I'm going to put here, you hold that first. I got other stuff.
Oh, wait, but there's more. Here, we can set this stuff down.
So, I think it's time for a toast. Yes? Thank you. Thank you. A short toast.
All of you at home, if you have something handy.
You may quickly pour yourself a cup of champagne or wine or whatever you have. And here is to 40 years of caring and service, to 40 years of teaching and mentoring, 40 years of innovation and growth. It has been a privilege to be part of what you have created. You will be so missed at NFP, but your spirit will live on. I wish you a magnificent, jubilant retirement full of adventures. I know you're going to have lots of adventures. You already went on one last week. You already took your first adventure. Full of adventures, full of joy, and full of great health.
Salud.
Salud.
Thank you all.
Thank you. Thank you for being
with us. A very happy night.